Dr. Vikki Petersen here. A couple of weeks ago you heard me talk about the interview with Dr. Peter Green on Nightline. And if you saw me, you know I got a little enraged about the information on that interview. The reason I did was multifold, but in the crux of it, it really comes down to the fact that I am very passionate about trying to ensure that everyone who is affected by gluten, whether it's because they have celiac disease or they are gluten sensitive, that every one of those individuals finds out as soon as is humanly possible so they can eliminate gluten from their diet and see the dramatic improvement in health that we would all like for everyone, let alone our family and friends. And I think some people thought I was kind of making things up and wondered if there was such a thing as gluten sensitivity, and those in the celiac camp are pretty impassioned about the fact that it's celiac or nothing. And so I wanted to give you some information that's pretty concrete, and that is an article by Dr. Peter Green himself. This article was from September 2009, so just a year ago, and I have a copy of it here, and I'll read to you the exact title. So it was, as I mentioned, an editorial, so this was not a research that he did in a study with a number of other people. He was the sole author of this article, and it's called Mortality in Celiac Disease, Intestinal Inflammation, and Gluten Sensitivity. So here's a copy of the article. There's the exact title, and it was September 2009, and it is an editorial by Dr. Peter Green. And in it, he talks about celiac disease, of course, and he also talks about gluten sensitivity. He specifically goes over a Swedish study, which was the largest of its kind, as well as a study out of Northern Ireland, and he talks specifically, as I mentioned, in addition to celiac disease, about patients with gluten sensitivity, which he defines as patients who have a positive anti-gliadin antibody blood test. So basically that's a test that shows that your body is making antibodies to gluten, the protein in wheat, rye, and barley, and that's a test that we use to measure gluten sensitivity. It's not a celiac test. For celiac, you have something called deamidated gliadin. You also have tissue transglutaminase, that's known as TTG. A lot of big names, don't worry about that right now. But suffice to say, his definition was that the patients with gluten sensitivity had these anti-gliadin antibodies, which I completely concur is a good test for gluten sensitivity, but they were not celiac, so they did not have positive intestinal biopsies. So what he said was that this particular group, like the celiac group, had increased all-cause mortality compared with the general population. So this means that your incidence of death increases when you are gluten sensitive compared to the general population who is not gluten sensitive. Similarly, if you have celiac disease, you're in that category. After you've removed gluten, they specifically mentioned with celiac patients that after 5 years that risk went down, but it was still elevated over the general population. And then he is in the final paragraph of the article. If you don't mind, I'm going to read a little bit to you because I think this pretty much says it all. He says that until recently, gluten sensitivity has received little attention in the traditional medical literature. Well, that's for sure true, and I must interject that when I first saw this article last year, I was pretty pleased by Dr. Green's turnaround with embracing gluten sensitivity. And of course, the research said it all, but here he was writing an editorial in JAMA, Journal of the American Medical Association, so I thought that was very good. So he says that although until recently little attention was given gluten sensitivity in traditional medical literature, and now I'm quoting again, he says, although there is increasing evidence for its presence in patients with various neurological disorders and psychiatric problems, which I've spoken about, it's in my book, it's on my blog, there's a lot of evidence showing that those patients with gluten sensitivity get a lot of irritation to their nervous system, which is the second most common system affected, and we hear the marvelous stories of patients with depression and anxiety and schizophrenia removing gluten from their diet. They are not celiacs, and those symptoms all going away, much to their delight. And here's how he finishes up the article. He says, it suggests that more attention should be given to the lesser degrees of intestinal inflammation and gluten sensitivity. And that is the final sentence in the editorial. So if more attention should be given to gluten sensitivity, Dr. Green, then why did you, a mere 2 weeks ago on Nightline, say that you knew of no reason why someone should go on a gluten-free diet unless they had celiac disease? Does that add up to you? Doesn't add up to me. It doesn't add up to what he said in his editorial. It doesn't add up to the research, and it surely does not add up for the millions of people suffering needlessly from gluten sensitivity who do not know it, not to mention how many people might have watched that Nightline segment and now have chosen not to even try a gluten-free diet because they think it's dangerous. So if someone asked you, here's the deal, I'm going to give you 2 options. You could increase your risk of death from all causes, or you could do something to enhance your diet such that you will get adequate B vitamins, adequate calcium, and adequate fiber. So here's your choice. You can do something with your diet, improve your fiber content, your B vitamin content, your calcium content, which is not at all difficult, by the way, with a healthy diet. Or you could increase your risk of death from all causes. Which one would you choose? I know, it's a ridiculous question, but that's what we're kind of being asked to do based on that segment. So, get a little angry like I am. Please share this information with others. It is unfair that people will not find out about this because now there's this thought that a gluten-free diet is dangerous. It's absolutely not, and actually Dr. Peter Green agrees with us. At least part of him does. All right, I hope that was helpful. Please do spread the word, and thank you all for the positive comments you've been sending me. I appreciate it. Until next time, I wish you very good health.